Stories for Our Daughters explores the tales of everyday women from the South Asian subcontinent who've been strong, unorthodox, and extraordinary in their own unique way. Be it for the bars they've raised, the battles they've survived, the ceilings they've shattered, or the courage they've inspired. These are women we encounter in our daily lives who, like so many of us, straddled multiple geographies, distinct systems, and diverse cultures. And their compelling journeys are presented in their very own words. I'm Madhuri Baldwa Bhat, and this is Stories for Our Daughters. My guest today, Dr. Leena Khanzode, is a child, adolescent, and adult psychiatrist and adjunct faculty at Stanford University. Leena is also the founder and president of Taarika Foundation, a nonprofit that creates mental health awareness and teaches stress management strategies, especially mindfulness. When Leena was barely a teenager, she realized her father had crushing bipolar disorder. Leena also saw her mother suffer harshly during his severe manic episodes that grew longer and stronger. So in med school, Leena decided to specialize in psychiatry to help not only her family, but also other folks like her dad with a focus on early diagnosis and treatment. After completing her fellowship at Stanford, Leena soon began her practice to help families and young children with mental health issues ranging from anxiety to self-harm. As a wave of teen suicides hit the San Francisco Bay Area a few years ago, Leena employed the mantra of prevention to start Taarika along with two colleagues to destigmatize mental health. Leena lives with her husband Atul and their daughter Sanya in the Silicon Valley region of California. Dr. Leena Khanzode, welcome to the first season of Stories for Our Daughters.
Thank you, Madhuri, for having me. It's an absolute honor to be part of this season, and I'm delighted to be here.
So can I call you Leenu, because that is what I'm used to, Leenu, calling you by your name at home. So is that okay if I carry forward with Leenu? Well, the professional world knows you as Dr. Leena Khanzode.
Absolutely. I'm totally fine with that.
Okay. I want to take you back to another time where you've decided to do psychiatry because you've had a situation at home where you realized that your dad is suffering from severe bipolar disorder. When did you realize, and how did you realize, like what were the circumstances or episodes that made you realize that this is not it's not a phase, or it's not just moodiness or a temper tantrum, but it's a more serious condition? Do you remember that time?
Absolutely. Like they say, you never forget some of the most difficult patches of your life. So I was around 12 years old when I first started to understand more about his mood phases and episodes. I would like to share an interesting part of my life story along these lines. So I stayed with my uncle and aunt between like kind of the prime years of early childhood, from second grade to seventh grade, for about 5 years. And that was the time I wasn't exposed much to my dad because I was living with my uncle and aunt. And so the reason I was living with them was, my dad was a civil engineer and he would get transferred to small villages for work. And that's kind of what happened around when I entered second grade. So he went into a really small town and there was no schools that were in English medium. And so that was really the reason why they chose to leave me behind with my uncle and aunt in the bigger town I was born and raised. And so so I started to understand more about my dad and his moods when I moved back in with my parents in seventh grade. He happened to get transferred to a slightly bigger town, which happened to have an English medium school. And that's where I rejoined my family. And I think I was also at an age at that time that things kind of start to make more sense to you. And I would see he would go through these phases of being, really happy, singing songs, like, he would love to sing in his shower and even other times. and then, was extremely productive at his work long hours, but still would have a lot of energy, sleep only for a few hours, and still got up in the morning and get going to work. And then what really stood out in his high phases, or the manic phases as we call them, he would be really kind of nasty to my mom. I think I'm understating the word. I guess he was almost nasty to cruel at times to my mom. Anything she would do, like socializing or talking to any other men, especially, that would trigger a lot of anger in him. We call this, now I understand the term, delusion of erotomania. Basically what that means is that you're constantly feeling suspicious about your partner, and because you love them so much, you are so possessive about them, you don't want anyone else to love them, kind of a thing. And so he would just create this false story in his head that she's doing something behind his back, and he would be standing there and she would just talk naturally, like you and I are talking, like smiling and just responding naturally. But he would put two and two together and say, you were giving this person extra hints and you have something going on with this person, are you cheating on me, those types of suspicions. And poor my mom, she was extremely social. She's still very social, and she would not like that. So she started to like hide things from him, which is unfortunately kind of not what helped. It kind of made things further worse. But she would like try time her outing when he was at work, and make sure she dresses up and goes and comes back and wears her home clothes. And she's, in fact, I remember she would take off the makeup, barely she would put some makeup, whatever, she would, in fact, look worse than her normal self in the day-to-day life. She would get her hair all scattered and look a little bit more just like she was just all day home, and just like a tired look. And even then he would suspect something had happened. He may find one handkerchief where she may have some lipstick marks, and that would be enough for him to create a story around it, and then really go after her. So I, at that age, I was always puzzled. I would wonder, what is this? I certainly had no inkling this was some kind of mental disorder. The best I could understand about it was it's his nature. जैसे हमारे culture में कहते कि इसका nature ऐसा है. So it was like, he's like this is his temperament. He goes through phases, but he's a good man. And that's what I would hear from mom. And thankfully, those bad manic phases didn't go for ever and ever.
Yeah. So, Leena, did you ever worry that your mom would get tired of this and she would leave him, or what kind of an impact was this having? I mean, now that you are yourself a married woman and you know how marriages in the best and the of times can be so stressful when you're raising children together, do you ever think back and wonder, how did she do it? Go through this emotional, mental, physical, whatever abuse it was, and still be supportive and still raise the three kids that she was raising? Do you ever wonder about what if she had left him? And did all of those thoughts come to your mind then? Do you think about it now?
Sure. Yeah, so we did have a couple rough patches where my mom actually did try to leave him because it was getting unbearable. I have a distinct memory of two such incidents. So this was when I was still living in Nanded, and this is my hometown, by the way, Nanded, where I was staying with my uncle and aunt. And I remember we used to go to visit my Nana Nani, during summer breaks, and we would just stay there for a whole month. And my mom had tremendous support from her parents, her brothers, sisters, and we would look forward to that time because that was like the fun time to be with the extended family and have, really, really kind of fun with cousins growing up together. So I remember that in that particular trip, my mom talked to her parents and her brother. I didn't quite understand much about that, but learned that she had made a decision to stay back even after summer break is over, and enrolled us in schools there in their hometown. And that was very concerning. And I would ask mom, and she would say, dad's not behaving well with me. He's not treating me right, and I'm done. And so we are going to be here. Your mamas and Nana and Nani are going to support us. So that's the plan. But then in about 2 to 3 months, barely within that time frame, my dad came over and again and apologized. He brought my grandparents, his parents, and some other extended family who had played a role in this relationship between my mom and dad, and they would convince every time, and this time they managed to convince again, and so we were back with him. There's another time when I was actually much older. I think I was in 10th grade, and that was the year actually my dad was formally diagnosed with bipolar disorder, but he was not super compliant with medications, meaning he would not take them regularly. Because of that, he had one episode where he was again really very harsh towards my mom, to the extent I think he got physical and hit her where she started bleeding, her around her ear. And that night she just packed her bags just by herself and she left. I remember she timed it because there was a train to Hyderabad early in the morning around 3 or 4 a.m. So past midnight, she just left all three of us and my dad. And then we wake up next morning and we realize she has left. And then we call her and she tells us what has happened. And then of course, the same story happens again. My dad apologizes, and he was so convincing when he would apologize. You would not believe that he's the same person. And then we would, as kids, say, he's saying sorry, mom, just like it's okay. He's saying he's not going to do this again. And so I admire my mom. I have so much respect for her resilience, her commitment to him is just, I don't think I could do it myself. I later on learned my mom actually learned about my dad's mental health issues within a week after getting married. So turns out that he's had this issue from, late teenage time, that he would go through these episodes. His parents would not think it was much more than just his nature. And then he was super excited to meet my mom, and they got engaged. And how there's a few months of period between engagement and getting married, you like exchange letters. Those were the times they would write letters. And he was madly in love with her, and he was so excited about this relationship. And my mom was like really looking forward to this, new journey of her life. And then comes time when, before about a couple of weeks before his marriage, he slipped into a big depression episode, apparently. And he was just like not interested in anything. He had stopped communicating with my mom, and she was puzzled because this guy was like literally writing her letters almost every day. And now it's like there's no communication, but maybe he's busy with wedding preps or something is what crossed her mind, and she forgot about it. Turns out he actually was so depressed. And back in those days, for severe depression and for you to come out of it quickly, we used to use electroconvulsive therapy, or ECT. Right. And so that's what they took him to Jaipur to the specialist, and he got multiple treatments for him to be actually able to participate in his wedding. And even at the wedding, my mom says he wasn't his usual self. He was kind of barely there. And then, a week into marriage, turns out he's not improving, and she had to go and live with him in Jaipur in that hospital, which provided facility for people to live because people would come out of town. Here is my newlywed mom with him, and he's getting shock treatments a few times a week. And so I used to ask her as she started opening this up with me, and as I understood stuff, I was like, why would you like not leave then? Like, you knew what you were signing up for. she was very upset, and so were my mom's parents, that none of my dad's relatives, his parents or brother, told them about this, that he had a mental health problem. So she, at that point, she tells me that she had a choice to, quit. But, there were two reasons she decided to stay. One was the smaller one, was the smaller amongst the two reasons. But one of them was, prior to getting engaged to my dad, she had gotten engaged to another person, but she learned about him a little bit more and did not like him anymore, and so she was the one who asked to break the engagement. And so she was already feeling guilty about having her parents go through yet another trouble to find another match for her. And so if she came out of this marriage, how would that impact her parents' reputation, and how would it impact her younger sisters who are going to get married, whether she would get married again as a divorcee. So those were some of the things. But the even bigger reason was, she was like, I believed that this is what I have to do. I have to take care of this person. He's mentally ill, and I'm married to him. My role is to be with him in his good and bad times. And so what I entered in the bad time, yeah, hats off to her.
She's telling you all this. She's telling you, and you realize the immense sacrifice that she's made, in her life. How did that impact your outlook towards your dad and towards marriage overall?
So yeah, Madhuri, I have to be honest that as much as I hated my dad during the times he was really so mean to my mom during his manic episodes, he was just a wonderful dad to all of us. He would adore all of us. He would call me, in Marathi, they have this phrase, it's called Pehli Beti Toop Roti.
Oh.
Toop in Marathi means ghee. So the idea is, how in our culture, they talk about girl is equivalent to Lakshmi, and she brings prosperity and luxury to your life. And so if you have a daughter as your first child, you're never going to go hungry. In fact, you will always have ghee and roti and like abundance in your life. I have to say our lives changed big time once he went into treatment, which was in my 10th grade, where he had a massive accident which led to him getting hospitalized at a hospital in Hyderabad. He was very critical at that time. So it was a very serious turning point in some ways in our lives. We had to move from this hometown Hingoli, where I was doing my 10th grade education. We had to move halfway through and move to Nanded back to be with family again. And then, of course, this accident led to another episode of his mood, and that's where psychiatrists got involved, and he was diagnosed and treated. So our quality of life did improve significantly once he went into treatment. He would not swing between those episodes anymore. And so that also gave me, I think, a different perspective on this, that, it was not he was doing it intentionally. It was the illness that was driving this behavior. And I think that also helped my mom to stay in the marriage longer, over time. But as far as my perspective about marriage, how that was skewed with this whole experience, I was kind of skeptical about it. Honestly, I was like, oh my gosh, what if I end up with somebody like my dad, right? You always kind of at that age, especially, you think about this, everybody's like that, or men are like that. And so I was very, I would not think much about it. That was my, I guess, coping, that I would just like say, okay, I'm doing med school, right now. I don't have to worry about any, marriage thing right now. When I was kind of getting ready to finally get married, I had a few, like how we have some requirements that you want from your to-be partner. I was like, I don't care about how financially well they are. I wanted to go in a family that was educated. Like, if I want a person who's open-minded and who's going to let me do what I want to do if I'm putting so many years of my life in this training.
So, Leena, before you got married to Atul, or when you were dating, or at what point did you discuss mental health? Did you ever do that, by the way? I mean, I'm just assuming you did, but
Yeah.
did you ever do that? And at what point, and how did you discuss this issue that, you wanted to inform him, this is the status with my dad? Did you ever have to bring that up? Was he, and how did he receive it?
Yes, so I was very clear that I was not going to keep that as a secret, particularly what had happened with my mom. I didn't want to do that again. I was very resentful of my paternal grandparents to hide this big fact from my mom and her parents when they got my dad married to her. And then, when I met with Atul, I was actually doing residency in psychiatry by that time. So I started to understand much more about bipolar disorder and the importance of family history and how this could run in families and how it can make you or your future child vulnerable. So to me, I thought this was a very important fact that I cannot hide. So I was very upfront about that when I met with Atul within, like, I think maybe the first or second meeting itself, that this is kind of what my background is. This is kind of what I understand about this condition, that there is a chance that this could this could make our future, kids vulnerable if we were to get married and so forth. And I was very clear with him that thankfully none of us, my brother, my sister, or I at that point had developed any mood symptoms or any kind of anxiety issues. My dad also had anxiety and almost OCD type of anxiety. So I was very open about it. To me, I felt like that was an important conversation to have to make sure there are no surprises later in the future.
Right. And so you get married to Atul eventually. This is the early 2000s, and you've already completed your residency at KEM, and then you come to California with him. You enter into a second residency program at Stanford, and eventually you're graduating out of Stanford with psychiatry again. So already you have such a big culture shift, and then you've had that even in your education, especially in psychiatry. How does cultural upbringing or outlook change how you're evaluating and diagnosing and treating patients? Is there any difference? And if there is, what kind of difference did you see or perceive?
Yes. So, when I was having to do residency here all over again, I was honestly a little bit resentful in the beginning. I was like, what? Like, I just finished like almost 3 years of training there, and you want me to do this again? But I'm so grateful I, did that. Of course, as soon as starting the residency program here at Stanford, I learned there were so many differences in how psychiatry is practiced in this country and in this culture specifically. And the differences really come from how the social structure is different. So let me share an example with you. So, at KEM, where I did my first residency in India, let's say if my brother or my dad is not well and I need to hospitalize him, so the inpatient units, where they actually stay and get treatment for a few days to stabilize them, are set up where the relatives actually sit with the patient almost 24/7. Here, we would not allow relatives come and visit the patients other than the visiting hours, which are like a couple hours in the evening. But the system we have, in addition to ensure that patient is safe, is that we actually put them on a legal 72-hour hold. So that was a very stark difference that I realized culturally. The other big difference I felt culturally was, how in India, we just not have our immediate family as your immediate like source of network or support, but you have your whole community, right? Yeah, if you're living in a community or colony, all the neighbors become part of your extended like support, and then of course your extended family and so forth. And so, it's fascinating, but all these networks of people, and you're talking about some of your problems or sharing some of your issues, it's almost like you're getting therapy from people that you trust and who you feel open talking about, right? Here, unlike, again, the social structure being different, where families are more nuclear and more independent or more focused on like a small unit, um, you know they really feel lonely and isolated. They don't have that kind of network to talk to somebody and get that kind of therapeutic help. People here feel the need even more so, and in fact are more open to talking to somebody, which is, I think, professionally right, because you want to talk to somebody who's neutral to you emotionally and not connected with you, who will also feel your pain. I mean, there is reason why therapists help more than just like your friends, right? But that those were the two kind of big cultural differences I noticed right away.
Leena, then let me take you back to that time where you yourself, there was a phase in your life when you had undergone some anxiety and depression. And this was, I think, because of a health issue that you faced after Sanya was born. So your child's already born, and then you have a health issue. And as a result of that, you face anxiety, you face depression, and then you needed therapy and you needed medication. So can you take us through that patch and what learning came out of it for you?
Yeah. So I look back at that patch as a really big, important patch that made me almost a different person, if you will. And a lot of learning happened, even though in that moment I was so upset about why me and, the traditional kind of thinking. But I think that was one of the best things in a way that happened to me now, looking back. So the time was, I had been almost finishing up my child psychiatry fellowship. So this was May of 2009. So I did my residency and then I moved into fellowship, and I was really looking forward to being done with training. I started my journey of med school in 1993. So I was like so very done. And I had had my daughter during my residency. She was 3.5 years old. And so I was looking forward to, spending more time with her. And in fact, honestly, we were also thinking about having a second child. I think God had different plans. So Memorial Day weekend, May, is when I actually developed very high fever and cough and was just down with something. And so I waited for a couple of days. We had plans to actually go to Los Angeles for that weekend to meet our friends, take my daughter Sanya to Disneyland and, celebrate the long weekend there. And so, because we had plans to leave on that Saturday morning, Friday morning before that, I'm like, oh, my fever hasn't gone down. It's been more than 48 hours. And, I should probably get some testing done. And so I went to the ER and they did my standard, like, workup for fever, like urine test, blood test, X-ray. And then comes out on X-ray, they see a patch on one of my lungs, which was suspicious of tuberculosis. And that was like, came from nowhere. I was completely blindsided by that. And they are like, it might be active. So we need to hospitalize you and we need to see if you are actually infectious actively. So, if it is the case, we have to make sure others are safe around you. So I was like, okay. So even then I was not understanding the gravity of the situation, how it's going to shift my life. So I get hospitalized. Of course, our plans to go to LA get canceled, which I was bummed about, but I was like, okay, whatever. I was like very hopeful that I was not acutely infectious. I had been working 80 hours, 90 hours a week all this time. I've been good with my energy, and this was just some random thing. And so my smears were negative, which is mean like actively I wasn't infectious. So they let me go. And then they do cultures, which is they take blood samples, and it takes 4 to 6 weeks for those cultures to actually come out positive or negative. So I was released and I was off the hook, and I was like, okay, beginning of June, I was scheduled to take my adult psychiatry boards in Denver. I land in Denver. And the first thing happens is I get a call from the Stanford attending doctor who had taken care of me when I was hospitalized a few weeks ago. And he's like, Leena, I have bad news for you. Your cultures for TB came out to be positive. And so I was like, wow, I was shocked, but I was like, okay. So he's like, we need to get you started on medication ASAP. Any, issues with that? I was like, no, fine. I, in fact, gave them a Denver pharmacy info, and I was like, I'll take my boards tomorrow morning. And tomorrow night, I will start taking the medications. And when I'm back in state, I will follow up with whoever I need to. And so then morning of my boards, I dress up, we wear like the suit and all, like I'm excited to be done with this. And so I go and I talk to the person and they basically say, no, we don't want to, take a risk and expose any of the patients to this. And if you wear a mask and take it, sometimes, we interview psychotic patients, they may get paranoid and suspicious. So if you fail because of that, this would still count as an attempt for you. And so it's your choice to forego, and we won't count this as an attempt. So you still have 3 attempts to clear your boards, or, you take a chance. And so I remember I broke down really right there at that weird hospital where I was supposed to interview this patient. And I was like, oh my gosh, what's happened? Like, this was a complete blindsided trauma that I had. So, it turns out we figured out the logistics of getting back home. They allowed me to be back on the flight with putting a mask on. And then when I got home, I was immediately visited by some county people who came to draw some blood samples and my sputum samples to see if I was actively infectious. And then they put me in home isolation. They also do what we call as antibiotic sensitivity to see if the traditional medications for TB are the right ones for you. And turned out I was drug resistant. So, they categorized based on that I had multi-drug resistant TB or MDR TB, which in fact is basically kind of the worst form of it. And it's essentially you have to use second and third line of medications, and you have to go through treatment for an double amount of the time for an additional year. So basically one bad news after another bad news, right? So I couldn't take my boards. I was put in home isolation. I was then told, oh, you have MDR TB. By the way, you're not going to be off the hook by 9 months. You would be in treatment for 18 months. And then the last one was that I can't go for my graduation. And then because I had MDR TB, they wanted me to have 2 consecutive cultures to be negative, which means my sentence was extended from 6 weeks to 3 months. So I was in isolation, and I think there was, honestly, at that time, there was a lot of resentment. I had a lot of anger about why me, but then nevertheless, that was the time also that allowed me to do some self reflection, introspection, and I think it was a period of growth for me, because I learned that I had been very harsh on myself all that time. I was trying to do everything perfectly, trying to be a perfect resident, a perfect fellow, a perfect mom, a perfect wife, and a daughter-in-law and whatnot. And I think that's what took a toll on me. It helped me also to have this growth in the area of spirituality, which I think was the biggest growth that came out of this. I had been part of this spiritual organization called Brahma Kumaris since my daughter was born. So I really got time to get closer to God. It turns out I was certainly coping with this stuff until December, when I first started waking up in the middle of night with panic attacks. I had started to respond to the treatment. I was able to go back to work, so I was having some normalcy in my life. But then I was surprised that after all of the things are starting to fall in place, why am I having panic attacks now? And that's how it works. So I was like, this is strange. Like now, I am worried about what else bad is going to happen to me. Okay, I need to get help. So I go to a therapist first, and then I try to see a psychiatrist, because I'm like, I need to be back on my feet. I have to work, and I need to, be mentally well. So of course, when they say when you have too much knowledge, it becomes dangerous. So that's kind of what went against me. So I'm like, I'm not going to go on an SSRI medication. And these medications have a potential to put you into mania if you have a strong family history of bipolar disorder. So I went on that path of like imagining the worst and catastrophize the worst of everything that's going to potentially put me into mania, because my dad had bipolar disorder, and here is what's going to happen to me, and I'm going to be hospitalized, and I'm going to have a terrible life, and da da da. And so I chose not to take the medication initially because I was so terrified. And then turns out another big reason I chose not to take that medication right away was because one of the medications I was taking for TB treatment actually interacts with this medication and can put you into this condition called Serotonin Syndrome, which is another life-threatening medical emergency. And I think my anxiety spiked big time when I went to take boards. So I went in January to LA to take my boards, and I did not do well. I think it was purely anxiety. I just froze and I blanked out, and I did not utter a word in one of the sessions in the exam. And that was like, okay, this is not good. And I think every time I would be somewhat okay until about the time I was starting to prepare for boards again. So since this trauma had its roots when it first happened during my taking the boards in Denver, I actually failed twice during adult boards after that, because I think I was not in the right mental frame. So nevertheless, I was doing therapy during that 1 year and failing those two board exams. And the therapy helped me. I think it really helped me to connect the dots from my past, that the fact that I was staying away from my parents during my crucial years really did something to my psyche, in addition to being, of course, vulnerable because of family history. I had to become this good girl and this perfect girl for my uncle and aunt, for my grandparents. And that perfectionism, I think, was instilled right there, which is what I guess gave me the best of the life in terms of so-called success during those years, because I was a perfect student. I was an A student. I came first. I did whatever. And so that praise that was given to me by my uncle and aunt, my parents, my grandparents, my extended family, oh, she lives away from her parents. Look at her. She's still doing so well. She's such a good kid. I think it only instilled that perfectionism more. And I think that in some ways became me. And I think that did compromise on my self-care as one of the factors that led to this medical condition, which kind of came out of poor immune system. The therapy was helpful. I was able to process some of the grief and trauma about going through this bipolar condition of my dad as a child that I hadn't processed all this time. I had also a lot of guilt about not being able to help my dad much right before he passed away. And the way he passed away was very devastating. He actually, had a very bad fall and died because of a very bad head injury. He was only 58 years old. I couldn't go and visit him or go to his funeral rather right away.
So you were processing all of this grief when you were diagnosed with TB and you're going through therapy. So this is what you were processing as well.
Yeah. So I went on that tangent because that's the insight I got in being in therapy, that I had so many traumas from my early childhood that I had been just going with the flow and going to the next thing and the next thing. And the therapy really helped me connect those dots and really understand that it's so important to process these things. I gained a tremendous insight into my professional world. I actually got an insight about how it is like to be a mentally ill patient, right? I think that was the best thing I think that happened from this. I could really understand people's pain when they called me saying I'm having a panic attack and how bad that is. I could understand how it is to live with anxiety. And I'm like, oh my gosh, this is truly bad. Like, when people come in this distress, they are really struggling. So it gave me a view from the other angle, which actually made me a better psychiatrist, I think, because I was, always compassionate and empathic, but I think it quadrupled that for me in a way, because I could understand what that is. Like, I've been on the three sides of it in some ways. I've been a caregiver where I had seen this happening to a family member and getting affected by that. Now I'm myself going through that. And of course, I'm a provider at the other end. And so, two attempts of boards that I was failing. And there was the last attempt I had to, finally click, and otherwise I would have to redo my written exam. After I failed my second boards, I realized actually I had now become depressed in addition to being anxious, which I did not understand that I was depressed. There are plenty of people with we call as high functioning depression, and I was amongst those, right? I was keeping a job, I was taking care of my daughter, I was in therapy and thinking I was managing my anxiety well. But whenever boards came, there was an overlay of additional anxiety and mood issues. Talk to my colleague and I say, I'm crying. I'm like, I failed again. And, I've been just not feeling happy about anything these days. I talked about a few symptoms. And as I'm telling her, she's like, aren't you listing symptoms of depression, Leena? And I'm like, you're right. Like, I'm talking about lack of pleasure or joy in things. I'm talking about lack of motivation. I'm low energy, sleep disturbance. I'm talking about feelings of guilt. I'm talking about, all those cardinal symptoms. And she's like, you thought you had a handle on your anxiety, that's good. But I think now you're depressed. You better get on your medication. And so because I was done with the TB treatment, and of course I had done some effective work in my therapy about not believing that I'm going to develop mania from that antidepressant medicine, or I'm going to develop serotonin syndrome, all those fears, I conquered those things in my therapy. I was like, yeah, now is the time. I need to go on the medication. So I went on a medication, which miraculously, within 4 to 6 weeks, I was back to being myself. And I was like, wow, this thing really works. Like, when I prescribe, I say that in confidence, but now I know that it truly works because I have taken it and it does work. So my faith in that prescription, whatever, in the treatment grew, and I felt even more confident because now I had gone through it myself, right? So that was an interesting span of a couple of years, which I would say gave me a lot of growth in personal, professional, spiritual, in many domains. I mean, I look back at that patch as like, oh, thank God that happened, because I am so much better today because of that.
Right. Hindsight, is a beautiful thing because you get a lot of learning from that as well. When something impacts a child or a young adult, it just does not impact a child. It impacts the entire family. Mm-hmm. So in your practice, why have you seen like a lot of the children are, they're anxious or they're depressed? What are the most common underlying factors, or are there common underlying factors, or is each case so unique that you can't see any trend?
Yeah, so I would say I can't say there is one particular, bag of factors that applies to everyone, but the general themes tend to be not very different overall. So, we live in a very unique area, right? Silicon Valley, full of entrepreneurs, young entrepreneurs. So I think we definitely see problems very unique to the teen, very unique to this area where teens are really affected by kind of the environment they are in. And as much as this is like a place to be, and there's so many like companies and so many things that motivate you and make you feel like, oh wow, I want to be here, the weather is great or whatnot. I think it puts a lot of pressure on the teens because they are seeing these very successful parents. They're surrounded by family friends or just friends who are all really doing very well. So in some ways, even though as a parent, I have a teen daughter, right? So if I'm trying to shelter her and I say, it's okay, you don't need to get A's. It's okay, you don't need to go to this Ivy League school. It doesn't matter. It is really important to them that they kind of fill the shoes of their parents, is kind of in one ways they think about that way, or they're literally talking about this, they're breathing this in and out. So there's a lot of sense of, where do I stand? Am I not as smart as this person? Am I not doing as many activities as this person? And so there is a lot of impact on their self-esteem. And then often there are cultural factors where, a lot of South Asian parents in the families I work with put a lot of pressure. Grades matter, which school your child goes to matter. Child is their prestige trophy, so they have to, look good is kind of the message they always are giving to the child.
Log kya kahenge, the brand of the family.
Yeah, log kya kahenge, brand of the legacy, has to continue. If your dad went to Stanford, what are you doing, at De Anza College, for instance, right? Like is kind of a big taboo. So there is that in terms of cultural factors. There is also, I think, unique to this generation, I guess, because of the instances in our world, and especially in this last 5-10 years, we've had a lot of bad news, right? Like, I mean, we are in pandemic right now, which has definitely shaken all of us, but the news around us is not very positive anymore. And so there is this sense of a shortened future, and they feel like we have only X amount of time in which we have to do something and do our best and make, our life and money and have a good life. I mean, I hear that. It's very interesting that's coming up more and more. During times like this, there is this whole loss of hope that why am I even doing all this? Will I even get a job? The economy is tanking. And so there is a lot going on in the world they are growing up. And I feel bad. Like, I think when I was growing up, when you were growing up, Madhuri, we had a hopeful future. There were so many things that we would feel good about, but lately the climate change, the political situation, I mean, there is lots of these subtle things that generate a lot of anxiety in youth. And even though they don't voice it, I think we all breathing it in, and it kind of is layering. And when bigger stuff happens, then it's like it all explodes.
You have a daughter who's now in high school. She's just entered high school. How do you, high school is a very stressful time for a lot of children, especially in the Valley, especially in competitive schools around the world, not just in the US, right? Or not just in California. Mm-hmm. How do you talk to her about mental health?
It's very interesting to have a daughter and not worry about her because I work with so many teen girls her age. So, I'm often worried about, is she using the social media safely, how involved or intrusive I should be. She's wanting more autonomy and privacy, often closing her door. And, how much should I knock and check in? So there are things like that, right? That because I'm like, what's going on when she's alone? But what I have tried to learn is that, of course, I see the worst side of things and my brain goes to that. So I try to put my professional hat away when I'm, at home, and try to like just think like a mom. And so I have certainly tried a lot to make sure I spend some quality time with her. You have to get creative to connect with your teen. So there are times when, she would talk about stuff just on our walks, but sometimes it would be like a show or something we are watching together, and that could be a point of connection. And she would bring up something about her or her friend. So that's one. I brought up social media, which is a really kind of, it has its perks and its scares. I shared this funny example because my daughter was persuading for getting an Instagram account since middle school. And I see so many bad sides of social media in my work where, either kids are being irresponsible or there's cyberbullying going on, and there's stuff that's not appropriate that, led to some of the symptoms in the teen I work with. So every time she would ask about it, I would say, no, not until you start high school at least. And, she actually was so persuasive that she created an PowerPoint presentation once to convince me and Atul that she needs to get it. And she was so honest in that presentation. She not only wrote about why she wants it and what are the perks, she also wrote about the downside. So she was like, I know these are the concerns, but we had made up our mind that nothing doing till end of middle school. And she would be mad at me, I hate that you're a child psychiatrist just because you see worst side of these things. I'm not going to be like that. And I would catch my breath and say, Sania, it's not about you, it's people around you. Not everybody's mature at your age. It's, people can get impulsive and not super mature. So I would try to generalize and help her understand. And so I think also working with your teen is also a little bit of a delicate dance. You have to negotiate, you have to win some, you have to lose some. So I certainly try to do that. I'm actually also very open with her about mental health issues. I know she carries hereditary predisposition from my dad, from me. My mom's side of people are also pretty anxious, so anxiety kind of runs in our families. And so I know she has a bit of an anxious temperament. So I've plugged her in with a therapist that she talks to periodically. So she has a safe person who she feels more comfortable talking about this stuff. Again, this is because I'm in the field, I'm more on the prevention front, and I'm all about prevention is better than cure. I want her to have the tools to manage day-to-day stress. And so that's what, I've been doing. I think having an open communication with your kids about things that seem uncomfortable is always a good idea, whether it is about sex education, whether it is about mental health issues. I mean, all those things that we feel like we want to shelter them, but you're really not sheltering them anymore. They are exposed to these things anyways. She knows more than what I think she knows.
So tell me a little bit about Taarika. How did you start it? It's common knowledge because of the website and all of that, that the spate of suicides that we had in the Bay Area a few years ago among teenagers, that was what prompted or sparked the idea. But tell us a little more about how you and your colleagues went about thinking, okay, we need to have this, and this should be the focus. So tell us a little bit about that.
We all know the rates of anxiety and depression and suicides in teens has gone up big time in the last decade. So I entered the world of practice in 2009, late 2009. I worked for a nonprofit for a couple of years and then branched out and started a private practice. And what I saw repeatedly in my practice is that teens are coming in with lots more issues related to anxiety, depression, and self-harm. The cutting, I mean, it's very mind-boggling, like how does cutting yourself make you feel good? Like you might wonder, like, why do people cut when they're dealing with so much emotional pain already? Why would they cause physical pain, right? But the understanding is that physical pain in that moment seems like a very big source of distraction, because the emotional pain that they're dealing with is so unbearable and so unpleasant and so hard that you want to get a break from that. And as a strategy to get a break from that, people cut and feel that physical pain again. I mean, it's almost like this idea of like, I'm so emotionally numb, I'm not feeling anything, and so I want to feel something, and that's why they cut. And then there is also scientifically understand cutting helps release endorphins, and so that gives them a moment of pleasure or sense of some release of stress, which is what keeps them going in that cycle. People also walking in my office with other types of self-harm, sometimes burning or pinching or hitting themselves, then suicides, and then there was this cluster of suicides in our area a few years ago. So I was feeling really emotionally torn by this. After doing a lot of soul searching, I was like, I can see a few people in my private practice and provide help to only a handful of those people. What can I do to reach more community to help them, in a bigger scale? from our work experiences, so I met with our, two other co-founders of Taarika, who are other child psychiatrists, my colleagues. And I met with them a couple times, and I was like just opening my heart out and talking about how disturbing it is. And we were all talking about, like, a lot of this is kind of preventable, that we can actually catch this early. A lot of those parents don't realize that the kid is on this path for a while, that they need more support. A lot of the times there is no awareness about this. And so that's kind of where we decided to focus on. And so that's kind of what led to the idea of forming this nonprofit called Taarika Foundation. And we picked the name Taarika because Taarika in Sanskrit means little stars. So since our kids are little stars, we want to keep them shining and have them have this bright, shining future. So our focus is to create education and awareness around youth mental health. And we do this through, doing workshops and seminars, and offer lots of different kinds of services. We've conducted lot of community events where we are having, youth talk about their mental health issues openly. I also got certified in mindfulness training a few years ago, which has been another focus of Taarika. So I run mindfulness groups for teens, and then for younger kids, 10 to 12-year-olds, along with their parents. Our most recent project that we are very excited about is this podcast that we launched a few months ago. It's called Mindful, Beautiful, and Thriving. And it's available on all Apple, Google, and Spotify podcast platforms. And our focus is, again, having little bite-sized episodes on topics related to youth mental health, for parents as a separate series and for youth as a separate series. I'll just leave you with my website information that also guides you with a lot of other questions you may have. The website is www.taarika.foundation.
Oh, wonderful. Leena, thank you so much for joining us. I genuinely appreciate it. The mission of Taarika is wonderful. I can't wait to see where you take it from here. Thank you so much.
Thank you. It's an absolute pleasure to be part of this beautiful journey with you, Madhuri. Thank you again for inviting me, and be well. Take care.